Hello, and welcome to celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the celiac.com forum online at celiac.com. And now, let's move on to the latest celiac.com news. Should you be on a gluten-free diet? A skeptical look beyond the headlines. Media headlines, including a recent article in Scientific American about gluten, often make bold claims. Gluten-free diets are unnecessary, or only people with celiac disease benefit from avoiding gluten. These statements are designed to grab attention, but they rarely capture the complexity of the science. While it is true that celiac disease, an autoimmune condition affecting about 1% of the population, requires strict lifelong gluten avoidance, there is also a large group of people who do not have celiac disease, but still report symptoms that improve when they stop eating gluten. This group is often labeled as having non-celiac gluten sensitivity or non-celiac wheat sensitivity. To dismiss their experiences risks ignoring a real medical issue that affects quality of life. The article in question was supported by Yakult, a company that produces probiotic drinks. While the editors may have maintained independence, the appearance of a corporate sponsor raises valid concerns about subtle bias. Companies that make gut-related products have an interest in framing dietary issues in a certain way. This does not mean the article is wrong, but it does mean readers should apply a healthy dose of skepticism when the take-home message seems oversimplified or dismissive of patient experiences. Many individuals without celiac disease report digestive or systemic symptoms such as bloating, abdominal pain, brain fog, fatigue, and even joint pain that improve on a gluten-free diet. Research trials on NCGS have been inconsistent, but several controlled studies show that a subset of patients does react when challenged with gluten. Others appear to react to components of wheat beyond gluten, such as amylase trypsin inhibitors, ATIs, or fermentable carbohydrates known as FODMAPs. Regardless of the exact trigger, the pattern is clear. For many people, reducing or eliminating gluten-containing foods provides relief. It is worth noting that self-diagnosed individuals often feel better on a gluten-free diet even before any medical testing. While some of this may be due to placebo effects, the consistency of these reports suggests there is a genuine biological basis for symptoms outside of celiac disease. For those with celiac disease, strict gluten avoidance is non-negotiable. Even trace amounts of gluten can damage the small intestine and increase long-term risks such as osteoporosis, malnutrition, and certain cancers. The debate over non-celiac sensitivity should not overshadow this reality. Instead, it should highlight the importance of accurate diagnosis. Patients who suspect gluten is a problem should be tested for celiac disease before adopting a gluten-free diet. Otherwise, valuable diagnostic evidence may be lost. For people who do not have celiac disease but still feel ill when consuming gluten, the message is more nuanced. Dismissing their experience as all in their heads is unhelpful and misleading. These individuals may benefit from a diet that reduces or removes wheat products, even if the trigger is not gluten itself. The goal should be symptom relief, not strict perfection. In many cases, reducing wheat intake by 80 to 90% is enough to improve quality of life. This perspective challenges the headline claim that there are few health benefits to a gluten-free diet unless you have celiac disease. For a sizable minority of people, the benefits are very real: less pain, better digestion, improved mental clarity, and more energy. Critics often argue that gluten-free diets are risky because they can be low in fiber or rely on ultra-processed gluten-free products. This can be true, but it is not inherent to the diet itself. A well-planned gluten-free diet rich in fruits, vegetables, beans, nuts, seeds, and naturally gluten-free grains such as quinoa and buckwheat can be both healthy and nutritionally complete. The real danger comes from over-reliance on packaged gluten-free foods, which may be high in sugar, fat, and additives. Researchers are increasingly discovering that food intolerances exist on a spectrum. Celiac disease is the most clearly defined, but gluten sensitivity, wheat sensitivity, and FODMAP intolerance all overlap. Some individuals who think they are gluten sensitive may in fact be sensitive to other wheat components or to poorly absorbed carbohydrates. Others may have both celiac disease and secondary intolerances that complicate recovery. This complexity cannot be captured in a single clickbait headline. The debate over gluten-free diets often swings between extremes: enthusiastic endorsement on social media versus skeptical dismissal in the medical literature. The truth lies in the middle. For people with celiac disease, avoiding gluten is essential. For people with non-celiac gluten or wheat sensitivity, reducing gluten may significantly improve symptoms, even if the mechanism is still under investigation. And for the general public, gluten avoidance may not be necessary, but is not inherently harmful if the diet is balanced. What matters most is listening to patient experiences, respecting the limits of current research, and avoiding simplistic claims, especially when the article is underwritten by a company with commercial interests. For anyone struggling with unexplained digestive or systemic symptoms, careful medical evaluation and a thoughtful dietary approach may make a world of difference. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in and see you next time.